Hello everyone and welcome to Our Ventura TV. I'm Sandra Siepak. On today's show we're welcoming Amy Towner. She is the Chief Executive Officer of the Healthcare Foundation of Ventura County. Thank you so much for joining us on the show today.
Well, thank you, Sandra. It's nice to be here.
Absolutely. You handle many of the development and issues for the Healthcare Foundation, so let's talk about some of those that are most important to the organization.
Terrific. I'd love to do that. Healthcare Foundation actually is the nonprofit that supports the Ventura County Healthcare Agency. So maybe we'll back up and we'll kind of describe that a little bit.
That would be great.
Ventura County Healthcare Agency is the public health and hospital system that serves Ventura County.
Okay.
So anyone in Ventura County has access to this care.
Mm-hmm.
And what it's comprised of, Sandra, are inpatient acute hospitals, which is Ventura County Medical Center, Santa Paula Hospital, and an inpatient acute care psychiatric hospital.
Okay.
Okay, and then also the next level is 46 ambulatory care clinics that are spread all across Ventura County.
Okay.
Then next we have public health, and public health is our first line of education. And then we go to behavioral health, and behavioral health is one of our service lines that actually weaves itself through the entire system. So they have their own clinics, they have co-located clinics, they're inside the hospitals, so they're the ones that really allow the whole person care to really happen.
Okay.
And then of course we have medical examiner and emergency medical services. So it's a very robust and integrated system that's here to serve our county and everyone within the county to be the safety net hospital.
Now, when you mention that anyone here in Ventura County can use these particular programs and services, does that matter if you have insurance, no insurance? What does that entail?
Correct. Anyone in Ventura County can access those services.
Okay.
Unless you have Kaiser, then of course you would go to your Kaiser hospital or doctor.
Right.
Or if you were a veteran, veterans would go to the Veterans Hospital.
Okay.
The Veterans Hospital contracts at times with the county.
I see.
So you might, as a veteran, go to the Veterans Hospital, but then they will say, you know what? The county hospital is going to be able to do this particular surgery well.
Okay.
So that's how that works. And then within that system, we also have a lot of care that is specialized. So like Ventura County Medical Center is the only West County licensed inpatient acute care hospital, complete with pediatric intensive care unit, NICU, trauma, West County trauma. So if you were in a trauma, then you would go to that hospital.
Okay,
so
terrific.
Yeah, so that kind of paints the picture of the system.
So there's quite a few entities that encompass this whole system. And let's break each one down a little bit and talk about some of the benefits and programs that each offer. You did mention behavioral health, and we've mentioned some of the other ones. I was wondering if you could go down the list and kind of just focus on each one briefly.
Sure, and how Healthcare Foundation.
Right.
Yeah, so I like to always call it philanthropic investment for these different divisions.
Right.
Lots of different ways to engage. Sometimes it's through our philanthropic dollars purchasing items.
Okay.
And some of those items might be items that are helping to create a stronger, more viable system. For example, a quality measure we found was if we increased our breastfeeding rates in our inpatient hospitals, that we had $700,000 of capturable revenue. Okay. Well, that's wonderful. So we were able to, the foundation was able to purchase Boppy pillows, which are breastfeeding pillows for the moms, to increase those breastfeeding rates.
Okay.
This also affects public health, which is educating how to keep your babies healthy, and also behavioral health, because moms with postpartum depression, etc., these breastfeeding activities actually help with all of those. So as you can see, it's so integrated amongst all the different lines, which is really nice. The other things that we do for and people that we engage with are service clubs and different organizations, like I think Lions Club we've spoke of before. And Lions Club has joined, their mission is vision and diabetes. And they made a generous donation of retinal camera scanners. And so we were able to put those in all of our clinics for scanning the retinas of people that have diabetes and other such related diseases. And that's been able to increase some of those reimbursement rates for your county health and hospital system. So these kind of alliances are huge and very powerful in our community.
The philanthropic investments really sustain a lot of these programs and make it happen for many things that you're doing. And I think that's something that, we're very happy to hear more about. I know that you also are a part of building the new Ronald McDonald House here in this system. So I wanted to talk a little bit about that and kind of catch up and find out where we are with that as well.
Absolutely. Another great example of philanthropic investment and a global partner.
Very much.
And that global partner wants to align with health and hospital systems that have this type of dedication. And to our knowledge, we're the only public health and hospital system that they have aligned with.
I see.
So this is really special.
Yeah.
Last year there was, or the first Ronald Walk, there was over 900 walkers.
That's
incredible. We never dreamed that we would have that type of response for a family room that hasn't even been built yet.
Right.
We're estimating that the family room will hopefully be built and completed by the end of 2020.
Oh, good.
Yes.
So we're coming up.
It's coming up. And we'll have 2 dedicated spaces. There'll be a family room, a space, and a quiet space. And what these spaces are, Sandra, is they'll be a place of respite. So inside Ventura County Medical Center, there is a dedicated women's and children's floor, complete with obstetrics, pediatric intensive care unit, and then also a neonatal intensive care unit. Okay. Also on this campus is the Children's Center for Cancer and Blood Diseases and Pediatric Diagnostic Center. Some of the sickest children get taken care of here, and kids as far away as Arroyo Grande come to Ventura County because of the incredible care and specialty care that we provide.
And again, let's state that coming to Ronald McDonald House is something that everyone can be a part of, the entire family.
Correct.
Right.
Correct. So it's really there so that we can take care of families and that families can stay close to their kids.
Sure.
And also nurture that family unit as they are managing a child facing life-threatening illnesses and diseases. So very, very special.
And let's talk about the hospital system too, because that is pretty vast and it's pretty large. And again, what are some of the most important parts of the hospital system that you'd like to share with us?
Well, I think one of the most interesting things for the viewers is for them to know that Ventura County is a very conservative county, and healthcare is extremely expensive.
Very.
Most counties, out of the 58 counties in the state of California, there are only 15 counties that actually have a health and hospital system.
Okay.
And Ventura County is actually one of the most robust.
Oh, okay.
Ventura County is actually organized as an enterprise system. And so that means it's primarily supported through its own contributions, which is very unique. So very little comes from the general fund. So, and when you're talking about, let's say, Ventura County Medical Center as one, we have some of the best surgeons. We're the West County Trauma Center. We have a pediatric intensive care unit, which is very, very unique. There are not many hospitals that are able to provide this level of care. And your Board of Supervisors and County Executive Officer are dedicated to treating people close to home. So we have 118 licensed beds, and we are a teaching hospital. Our family medicine residency got the #1 designation from U.S. World News and Report for the 2nd time.
That's great.
So this program is very robust, and it's been around for 50 years. So something for our county to be very, very proud of, and something that we don't really talk about that often, but very, very special. We also got the Meritorious Award from our College of Surgeons. Unheard of. I mean, most people do not have that. So yeah, most institutions.
And I think it's really important for people to know about the clinics too, because the clinics may be something that they may think they cannot go to or be a part of. If they have insurance or they don't have insurance, people are a little leery sometimes. So let's explain that a little bit about the clinic system.
Definitely. So we're very fortunate to have a robust clinic system.
Right.
Clinics are located throughout Ventura County so that everyone has a neighborhood clinic that they can get access to a primary care physician.
Okay.
Some of those clinics also have specialty care, which is really nice. For example, in Oxnard, we have Los Islas Clinic that has ophthalmology as a result of Lions Club and their generous donation.
Sure.
And they're working on a diabetes clinic very special.
Right.
Another clinic is starting centering pregnancy, and centering pregnancy is something that's really very, very special.
Right.
Women are coming together in the same gestational age and having their check-ins, their visits
Right.
together, and raising
And
their
it's
kids
encouraging
together.
because they want to come in there.
Yes.
And they're getting better care for that. So that's really important too.
Creating community, Sandra, is so
Absolutely.
important as we
Right.
raise these children, because this is the next generation,
Of
and
course.
we want them to be healthy.
Right.
We want our moms to have support. We want these children to have a community, and I think that's what really makes Ventura County special.
And in fact, of the philanthropic investments that are made for the entire system, are there a lot of donations and sponsorships that encourage future programs that are coming up?
Absolutely, absolutely. So, and our leadership, we are part of the leadership team, and so a lot of times the leadership will come and see that there's a gap, maybe perhaps in our system,
Okay.
and they'll say, you know, this isn't being covered, and this is something that the county hospital needs to address. And that's one of the beauties of having a safety net system within our county.
Okay.
So yes, we can go out and we can go to the Rotarians or to Lions Club or to a major gift donor and say, you know, this is a need in our community. Does this resonate with you, and do you want to partner with us?
Sure.
And that's the beauty of having a nonprofit that is connected to your county health and hospital system. So we're leveraging public-private partnerships, because let's face it, healthcare cannot do it on just reimbursements alone.
Right.
And so the nonprofits allow our county health and hospital system to be nimble and agile in this ever-changing world of healthcare. And as you know, it's so ever-changing.
It is ever changing. It's changing all the time. And I think for this particular system, it's extremely important for the growth of the community, which of course Ventura County is growing rapidly. So the growth of the system is also keeping up with the growth of the population here, which in turn creates everybody, you know, to get served, and that's
Right.
also very important. What do you see the future for the system? Will there be new programs that we can look forward to? Will there be new things that will be coming into the hospital system? What will the future entail now?
So that we will definitely, the leadership of our county health and hospital system and our board of supervisors and our county executive officer are always kind of keeping their thumb on the heartbeat of our community.
Okay.
And responding to the ever-changing needs. We'll be leveraging telemedicine and telehealth.
Okay.
And these will be ways to save money so that we can make sure that we're growing that system in a fiscally prudent way.
Okay,
and
that's
making
good to
sure.
hear.
Right, exactly. So these types of things, whenever we're not going to add service lines just to add service lines.
Sure.
There's
Okay.
just no room for something like
Right,
that.
right.
But we're going to make sure that those service lines continue to be augmented and enhanced in every way that we can. And then if there is a service line that needs to be added, then the county will definitely be stepping up to the plate to see however the community needs to be served.
Right, to meet the needs of the community.
Absolutely. It was just like the Children's Center for Cancer and Blood Diseases.
Right.
No other hospital is doing that.
Right.
Why? It's expensive. It's expensive to treat kids with cancer. And, you know, these are acutely ill children. But with the help of public-private partnerships, all of that is possible. All of it is possible.
And it's extremely important.
It
really
is.
is for the future of the children too.
For children being treated close to home,
Absolutely.
it tears families apart. Them
Yes.
having to be on a freeway for over an hour with a sick child in the
Right.
back seat, and dad's at work, and their schoolmates are sad because they can't go visit them.
Absolutely.
So very,
It does make
very
a
important.
difference.
It's-
If you can, share the website with us and contact information,
Absolutely.
if that would be okay.
Yes. To contact Healthcare Foundation, it's www.hcfvc.org.
Okay.
And my number is 805-652-3361.
Terrific.
Yeah.
Well, thank you very much, Amy Towner, CEO of the Healthcare Foundation for Ventura County. You've been very helpful in breaking all this down for us and learning more about the system and what all of us can look forward to in being a part of it.
Well, thank you so much
Thanks
for having
again.
me today.
Absolutely.
Sandra. Thank
And thank all of you for joining us today on Our Ventura TV. I look forward to seeing you next time. Bye, everyone.